This HarmoniMD video tutorial covers how to enter and modify medication orders. A patient chart must be opened to add a medication order. You can see any medication orders that have already been placed for this visit here in the Chart tab. To add a new medication order, first check to see that an accurate problem is entered. A quick view of any problems already entered for the current visit can be seen here in the Chart tab. If the reason you are ordering a medication is not listed, first enter that problem. Having an accurate problem for whatever orders are being placed is critical for both best clinical practices and billing purposes. To add a medication order, select the Meds tab. Once on the Meds tab, you can see all medications that have been ordered for this patient, for both the current visit and for any past visits as well. To add a new medication order, click here. This opens the medication window. Let's review all the fields in this window. The patient visit will autofill with the date and time the patient was admitted. You cannot edit this field. The status field will default to active and also cannot be edited. This field can later be used to cancel, discontinue, complete, or put the order on hold. We'll look at this a little later in this tutorial. The priority field defaults to stat. Click on the down arrow to change the priority if desired. The indication field is required. As with all order tabs, this is where the problems entered for this visit will display. It is a unique drop-down list for this particular patient for this particular visit. If the desired problem is not listed, you need to go back to the Problems tab to enter it. If you try to save the medication order without selecting an indication, it won't work and the fields that are required will be noted. As you can see, for medication orders, there are several fields that are required. We'll choose an indication from the existing two. The medication field is a lookup field which searches your facility's pharmacy formulary. If you want to limit your search to just IV meds, check this box. Begin typing the medication you want to order and your list of choices will narrow. Let's say we want to order aspirin. As I type, the list reduces to 6. The 6 aspirin choices in this facility's pharmacy formulary. I select the one I want, and then if there are any medication alerts associated with this medication, a medication alert window will display. In this case, aspirin has a black box warning. Warnings on any medication are defined by your facility in the pharmacy formulary. Click here to close this medication alert window. As you see, 4 things happened. The medication is now highlighted in red. There is a warning in red that this medication will cause an adverse reaction. An override checkbox appears, and the Med Info field appears, displaying the black box warning. We must check the override box in order to proceed, which acknowledges that we are aware of this warning. The Med Info field will only appear if there is information to display. Medication information is defined by your facility in the pharmacy formulary. If the medication has a predefined dose, which is entered in the pharmacy formulary, this field will autofill. In this case, it autofills to 81 milligrams, and the quantity is set at 1. If I want to increase the dose to 2 tablets, I increase the milligrams, and that increases the quantity. This field is used to indicate the type of medication order it is. For example, if I'm ordering a maintenance dose of antibiotics, I can indicate that here. If the medication has a predefined route, which is also entered in the pharmacy formulary, the route field will autofill. Click on the down arrow to reveal your choices. Select the frequency for the medication from this drop-down list. If I choose a frequency that has times associated with it, those will appear here. The start date is optional. Use this field if you want the medication to start sometime other than now. For example, if you are ordering a maintenance dose immediately after you've ordered a loading dose, you could indicate that the maintenance dose begins tomorrow. Again, use the date button and the time button to set the date and time. Check here to set a specific time span for your order. As you see, this new line appears. It defaults to 1 day. If I change it to a different number of days, the stop date changes. Next is the treatment goal field. This is an optional area to describe the treatment goal. If you are the ordering physician, your name will auto-populate here in the Sign By field. If you are ordering on behalf of a physician, select his or her name from the drop-down list and indicate how the order was received: verbal order read back, telephone order read back, or written. Lastly, enter your PIN and hit Save. The medication will now appear in the patient chart, both in the Meds tab and in the Chart tab. Let's review a couple more things about medication orders. We'll click on the Meds tab to return to that window. As you can see, the doctor's name is listed on the order, whether the doctor placed the order or someone placed it on the doctor's behalf. Let's see what happens if I order a medication the patient is allergic to. Again, I click here to order a med. And then if I enter a medication for an antibiotic and the patient happens to be allergic to it, I will get this warning. Note that allergy information needs to be entered in the patient chart for allergy alerts to work. Click here to close the medication alert window. And you see that this particular med provides different medication information. And it also has an intravenous route, which includes a flow rate. Play with different medications and you'll see different boxes that appear for different information. I'm going to cancel this order, but since this window is so large, it's very hard to see the button choices down here. So if I grab it at the top and move it up, these are more visible. And I'm going to cancel this order. Let's take a minute now to look at modifying a medication order. As you see, there are 3 tabs in the medication window. This sorts the medication orders between active, discontinued, and canceled. If the status of a med order is changed to discontinued or canceled, the order is moved to that respective tab. In this way, all orders can be referred back to regardless of status. Let's see how this works. We'll click on the med order we want to update. And then within the status field, you'll see your options. Selecting Canceled will cancel the order and move it to the Canceled tab. As you see, there are several choices for discontinuing a med. Choosing any of these will move the order to the Discontinued tab. A medication can also be put on hold or completed. Let's choose Canceled for now. Then I need to update and enter my PIN. You may notice that the software now asks you for a reason when you are updating the medication. This is a new feature we've added to the software since this tutorial was created. We're constantly adding new features to the software, and you may find others that are not covered in these tutorials. As you can see, the canceled medication order no longer appears in the Active tab. If we click on the Cancel tab, we'll see that the order has been moved here. The Medication tab is also used for administering medications and for medication reconciliation. We'll look at these in separate tutorials. When using the Medication tab to place a medication order, please remember to use an accurate problem. Thank you.